It is my honor here to welcome you today for an exciting announcement that marks a significant step forward in health equity in Western New York. I am thrilled to announce that the University at Buffalo has been awarded $3.6 million grant, Igniting Hope in Buffalo, New York Communities, training the next generation of health equity researchers from the National Institute on Minority Health and Health Disparities. With this investment from the National Institutes of Health, we will launch a groundbreaking center of excellence in investigator development and community engagement, and it will be embedded in the UB Community Health Equity Research Institute.
In addition, UB leadership has committed support of an endowed chair in health equity, enabling us to recruit a national leader in health equity, and that recruitment is ongoing, and that person will be the director of our Health Equity Institute. Community engagement is central to our work. We've moved past the old idea of looking at communities as groups of people with needs. We view our community as an asset. Our community is helping us understand social determinants of health and how to attack them.
The collaborative effort that has resulted in millions of dollars in research and focus on closing the gap in health equities and communities of color here in Buffalo and in Western New York, that serves as a model for the nation, started right here at the University at Buffalo.
You can't get better than this when you have all of the professionals, all of the people who have the knowledge, and the people who have the experience of dealing with what we need to fix at the same table, and then you put resources behind it. That's a win-win.
We don't exist in a space without context, but it is imperative that we know where we come from and how we got here so that we can figure out where we're going and how to get there. There are communities that have not been made whole. There are families that have not been made whole. There are people that are advocating for themselves, but they need to have someone else advocate for them so that they can be heard when their voice is clear. And so this institute, this work, this grant, what we do together will be used to ensure that those families are made whole, that those communities are made whole, and that we are raising up researchers and doctors and medical folk across the spectrum that will hear the words when they're spoken.
This award will provide important resources for us to poke and pry with the purpose of understanding why so many of our people are so sick and die so young. We will fuel our curiosity and the curiosity of the next generation of researchers, many who will come from the very communities in which we have identified are the ones in need of transformation. This new investment in the health of Buffalo will empower us all to create the community that we all want to live in.
We are on a journey and we are committed, and this grant and this center is part of that commitment. Our goal here at the Jacobs School is to improve health of our community and our region, and by focusing on health equity, we're going to do just that.